watching Morning at NTV.
A very good morning. We're glad you're still watching Morning at NTV. Very interesting conversation we had there on Kickstarter with the UK Minister for Armed Forces and Priscilla, delving into what is no doubt a very, very pertinent issue around the world right now. But now let's go into Tech Note, where we're going to speak new technologies that are helping make sure that surgeries that are being conducted on persons in the country become more efficient, and of course ensure that health is guaranteed. Of course, joining us to understand how we can use laser technology for surgeries is Dr. Micheal Oling, a surgeon. Many thanks for joining us this morning. How are you doing?
I'm very fine, thank you.
It's good to catch up with you. Familiar face, no doubt. Played a bit of basketball sometime at YMCA. Are you still a star?
Yes, I am. As you can see, I'm still having the same shape and the same height.
Very fit, no doubt. It's nice to catch up. Now, Biolitec, in partnership with healthcare providers in Uganda, is providing demo laser surgeries, minimal access surgeries. That is how it's been described, to enhance patient experience, but most importantly, to introduce new treatment options for the different conditions across board. Just take us through what this is all about.
Okay, so once again, I'm Dr. Micheal Oling. I'm a general and laparoscopic surgeon working at IHK and Ruby Surgery Center. Basically, lasers are energy devices. Lasers are used in different industries. They can be used for engraving, metal material, but in particular, I want to introduce you to medical lasers.
Medical lasers.
Yeah, medical lasers are also many in different categories. Some are used for skin conditions, but I want to talk about the ones used for surgery.
That's right.
The ones used for surgery are called diode lasers. These are lasers that range from 10 watts up to almost 200 watts in terms of power.
In terms of power.
Yeah.
On the average comparison with the average bulb, what amount of power are we dealing with?
Depending on the procedure you're doing, if you're doing a basic procedure like a hemorrhoid surgery, the power is almost 15 watts, which is comparable to some bulbs that we use at home.
Okay.
But if you're going to do a hemorrhoid surgery, a BPH, which is a large prostate, you need power of up to 200 watts, which is really about 20, I think 20 times the power of an ordinary household bulb. Yes. So laser technology is basically not new in the world, but relatively new in Uganda. We started doing the surgeries in 2016. Yes.
So that means why, if laser technology has been employed across the globe in other settings, and we are simply embracing it in the last few years, why is that so? Is it a case of cost? Is it a case of our inability to adapt quickly to the technological advancements across the globe?
It's our slow progress towards technological advancements across the globe.
Okay.
And personally, I was introduced to lasers in 2016. We were trained by Biolitec, a German-based manufacturer of lasers. The first trained were 3, myself, another surgeon at IHK, and another one at Nakasero Hospital. The first surgeries were done in 2016. They were all successful.
Oh, wow.
Yes, and from then we've tried to scale up the procedures, trying to include our colleagues. To do these surgeries, you have to be trained. It's nothing complicated, but because it's a lot of energy and specialized energy, you have to be trained so that you minimize the complications. Yes.
All right. So you speak about the fact that it requires a high level of training. I don't know whether you as surgeons, the numbers are sufficient to cater for the patients, that is in terms of a patient-doctor or surgeon ratio. Are we at a point where we can say you can meet the demand? For example, if all of a sudden knowledge about this becomes apparent and then patients begin coming in, do you have the capacity to be able to handle?
At the moment, I would say no, because we are few. Trained surgeons are few. We could be maybe less than 20 who are doing laser surgeries in the
entire
country. And this is in a span of 7 years, from 2016. And if I'm to discuss numbers here, basically a third of my work is anorectal conditions as a surgeon. So you find that if my average number of patients per month, surgeries, is about 30 patients, so a third of that work will be an anorectal condition like a hemorrhoid. So I'm doing about 10 hemorrhoid surgeries a day, and I stopped using other techniques. I'm only using the laser. And my colleagues will also have similar kind of work rates. A third of their work will be hemorrhoids. But also we now know that a third of the population is affected or inflicted by hemorrhoids. So if you look at the adult population, it means that about roughly 6 billion people have hemorrhoids in Uganda.
6 million?
What's the adult population? About 18 billion?
The adult population more than 17?
So it would mean that about a third of that will have some kind of hemorrhoid. So if you look at the numbers, we are basically overwhelmed. And if you look at the availability of resources, we are really concentrated in Kampala. So it's a blessing that Biolitec is in the country and trying to scale up the surgeries and train more doctors so that we can also make the procedures available in all parts of the country.
Okay, that's very eye-opening. I would be remiss if I do not ask you to relate to what is happening within the public sector. I don't know whether there is effort, for example, by the government to be able to bring private institutions, health facilities on board, so that there is an arrangement that can be able to afford the average Ugandan this kind of a service. It could be a partnership with the government, or it could be a part of corporate social responsibility on the part of the private actors.
Okay, so maybe to answer your question, initially in 2016, laser procedures were not so popular. So we started using them for treating varicose veins, hemorrhoids, fistula in ano, and these were basically the top 3 procedures. However, lasers can be used in areas of urology, in areas of ENT, even to treat tonsils, in areas of the chest to treat lung diseases, and even to treat cancers that are spread to other parts of the body. So the applications of lasers are broad. So with time, we started realizing the benefits of using lasers, and basically we came to realize that if, say, a person had surgery for hemorrhoid and they use the laser, they would be able to return to work the next day. As a matter of fact, the procedure would take about 20 minutes.
20 minutes.
As compared to 1 hour if you're using the open, all technical surgery. So we realized that the benefits of using a laser technology basically outweigh the initial costs. So the long-term costs, if you compare long-term costs, lasers are at the end cheaper. So government also has surgeons. And they realize that this technology is good. As I speak today, I know that they performed percutaneous laser disc decompression, which is basically a technique where you use a laser to treat a disc that has slipped from the back. And these procedures were done at Mulago yesterday. Of course, with the help of...
That interests me. That's why you see me trying to press buttons here so that I can find that particular thing. But just go on that.
Yes. And then at the same time, I'm aware that the new UPDF hospital made arrangements to have lasers commissioned in the new hospital. So I know that government has embraced this technology, and it will be available in the public sector as well. When we speak private, there are 2 ways a hospital can use lasers. They can acquire their machine, that is, you buy the laser directly. When you buy the laser, you're going to have to buy what we call fibers. These fibers are the consumables that you use for the different surgeries. If you're going to do a vein procedure, you need a different fiber. If you're going to do a hemorrhoid procedure, you need a different fiber. If you're going to do a fistula, you need a different fiber. So you could buy the machine and just keep on buying the fibers, or you could hire the machine. Biolitec has made arrangements, and there are different companies in Uganda that have Biolitec machines that they're able to hire out. So they hire it out at a cost. So basically what I'm saying now is any hospital
can be able to achieve,
can hire this machine
and then do the surgeries.
And empower their surgeons to perform the surgeries.
Okay.
Yes.
Well, by the time a hospital gets to hire, then it means acquiring one of those technologies is pretty much expensive. But as we speak, what is the cost of being able to get one of these particular services?
Well, the cost of a laser procedure will depend on what procedure you're doing. I mentioned earlier that we use lasers for hemorrhoid surgery, for varicose veins, for laser disc decompression, for treating fistulas, especially in the anal region, and many other applications. Yeah. But to speak in general terms, the average price will range from $1,000. That's the least maybe you could get in the market, but prices will vary according to the hospital, to the different hospitals in Kampala. And the most expensive at the moment that I know will not exceed $2,500. Okay. This is when in Uganda, when you are in Uganda.
You're in Uganda.
Now I have performed surgeries in Dubai, and I've also performed surgeries in Tunisia and in Egypt, and even in India, using the same lasers, and even on some Ugandans. And I'll tell you the truth, the price is about double. If you do a hemorrhoid surgery in Dubai, even if it's a Ugandan, the price will be about $4,000. I could have done the surgery in Uganda at $1,000.
Just to bring this cost home, because when we speak dollars, people might be wondering, might don't necessarily understand exactly how this factors into their day-to-day life and their ability to meet this particular budget. $1,000, about 3.5 million Uganda shillings is what it costs. Many of us in Uganda, and I'll be very honest, a single trip or a condition that leads you into hospital could mean you're going poor. How is this being, I don't know how to describe it, but is there an arrangement to help those who might grapple with meeting the cost?
You raise a very important point. Uganda is becoming really a health giant. You notice now that insurance companies are also embracing technology. Yeah. So we have insurance also on board, and they're actually covering for these surgeries. So I would really urge everybody out there to try and sign up for different insurance companies, so that you don't get into this kind of trap. Okay. It's maybe very difficult to lower the cost because there's a general worldwide drive to try and lower infection rates, and nobody wants to get a surgical site infection. So unfortunately, the laser fibers are one-time use. One fiber, one patient. Once you use it, you need to throw it away. That's what makes it expensive. Okay. If there was a way of reusing it, the prices would come down. But you imagine putting a laser fiber in one person's vein, and then into another. No. It doesn't operate. So those are the challenges with healthcare. But then again, Uganda might be having the lowest rates. Like I said, the same laser case in Uganda will be 3.5 million. And in Dubai it will be 15 million. 15 million. Yes, and I speak this with a lot of confidence because I've been in the same situation. Okay. Yes.
All right. So talking about a patient experience, these laser surgeries, well, like you said before, it doesn't take a lot of time. Somebody could do it and then the next day they are able to go to work. Yeah, no doubt if I'm a patient and I'm able to be able to go back to work and do a lot of what I have to do is pretty good. But talking about general patient experience when using latest technologies, I don't know where we are because most of these technologies do affect you after. Could you just give us an overview, not necessarily only on the demo lasers or the Biolitec, but generally the technology we are using in the country for healthcare?
Okay, so I'll start by talking about penetration. Technologies getting into the country. From my experience, it's not so easy to bring in technology into Uganda. There are very many. Basically, Uganda has a very strict NDA and UNBS. So there are very many standards that you have to meet. In this country, you'll notice that we're talking about Biolitec from Germany. I've not yet seen a Chinese or Indian laser into the country. I don't know if they would meet the standards, but what I can tell you, the government is quite strict on the standard of medical equipment that comes
into the country.
Yes, and then when this equipment comes in, we have to embrace the technology. Now, in regards to lasers, this is technology that dates back to almost 40 years ago. 40 years. So other countries have been using this technology.
Yeah, people have already been using it.
And it's tried and tested. Literature is available. Google is our friend. You can check it out. You will find a lot of literature. Now,
I like that.
In terms of confidence to the clients, first of all, for a surgeon to perform a laser procedure, they have to be trained.
Yeah. Certified.
You have to be trained, certified, and passed. I say this, and sometimes my friends think I'm just cracking a joke, but in Tunisia, we did about 18 surgeries with a colleague of mine, Professor Garukande, and this was the time when we were training. We did about 18 surgeries in the morning. 18
surgeries before midday.
Before midday. At midday, we were eating bread in Tunisia, bread and olive oil, and we're enjoying.
Wow.
But the efficiency is just very good.
Okay.
And we were able to even review patients who had come back and needed maybe a redo of a procedure. So we basically understood this technology, and that's why we embraced it. Maybe to even explain things further, a hemorrhoid, let me use a hemorrhoid to explain. A hemorrhoid is a swelling. So if you have a big swelling and I cut it, you probably have a very big wound if I cut it.
Yeah.
And this wound is in the anal area. The anal area is as painful as the lips. Imagine have a wound on your lips. We used to play basketball together.
Yeah, sure.
Then
the guy,
your lip, you know,
the guy knocks you, and then
so you're out for many days.
Yeah.
That's how painful a wound after hemorrhoid surgery is.
That's right.
But if you're using laser, a laser is a needle. So you just make a slight puncture on the swelling and you release the energy. What it does, it just shrinks the swelling.
Shrinks the swelling.
Yes, it has a very high affinity for hemoglobin, and it has a very high coagulation properties. So it stops bleeding very fast and it causes shrinkage. I'll use another example. If you have varicose veins, and you had seen me in 2010, I would have to make a cut in your brain and put what we call a vein stripper, and I would basically uproot this vein. It's crude. I would manually uproot it. But with laser I would use ultrasound scan, introduce a cannula into the vein, and put the laser fiber inside the vein. I would seal off this vein, and what you'd have is just a puncture site, similar to what you'd have as a cannula.
As a cannula for no more intervention.
Yes, and after this vein procedure, we actually ask you to walk home and continue walking and continue with your activities. If you did the old technique of stripping the vein, we need to tie your leg with a lot of bandages and ask you to stay in hospital for at least 4 days to monitor you so that you don't bleed.
Yeah. So I think at the end of the day, the cost initiative there is understood. You can 3.5 million to avoid a lot more that could come as a result of you could even get infections and stuff like that. Now, treatment options for the different conditions. If, for example, the 3.5 million is on the high side, and we've tried everything. I've called my cousin, I've called my uncle who works in some big office, and he has also said no, things are a little bit tight. What are the options if I can't go for a laser, demo laser surgery?
So the different conditions will have different treatment modalities.
Yeah.
If we talked about a vein surgery, for example, you would have to think about undergoing venous stripping or using glue.
Is that what you described earlier?
Yes, surgical.
The
or
surgical.
Using glue. Glue is another technique where yes, you can actually glue vessels. It's called venous seal.
The word glue alone is just a little bit scary.
It works like super glue. So you get into the vein with a catheter, and then you glue the vein at every spot. But like I said, this is heavy for the surgeon.
Heavy for the surgeon, yeah.
And it can be done, but the surgeon will not have a very good experience. And you want your surgeon to be happy. You want your surgeon to have an easy procedure.
Not to get agitated at a certain stage.
So the more difficult the procedure is, basically the more likely that you'll have adverse outcomes. And I'll tell you, the truth is technology improves outcomes.
Yeah.
So if you have technology, you need to use it. Healthcare, good healthcare comes at a cost.
Comes at a cost, no doubt. So as we enter the final bend of this discussion, could you briefly take us through access to Biolitec and of course the laser technology? I'm sure there are people out there who are watching, those who are putting out these services to the people? They own either medical facilities or centers. How do they access this particular technology within the country?
So Biolitec is actually around as we speak today.
Yeah.
The manufacturers are in the country, but they also have offices in Kampala near Brookside. I don't know if you know Brookside, that industrial area. Brookside, yeah, where there is basically next to Bata, where there is a sports ground next to Bata.
Okay.
They have offices there, but those are the manufacturers. But Biolitec has also made its lasers available in different hospitals. I know Nakasero Hospital has a laser, Ruby Surgery Center has a laser, IHK has a laser machine. And then I also know that there are companies, Angelo Foundation Medical Supply, who hire out laser machines and also sell fibers separately. The cost of lasers are basically almost standard. Everywhere you go, you will find that the prices are quite similar. There's just a slight variation.
All right. Yes. Dr. Micheal Oling, many thanks for the perspective on the use of laser technology, for surgeries that is beginning to take